This segment is sponsored by HomeTown Pharmacy. More than 37 million Americans have diabetes. That's more than 11% of our total population. The vast majority of those people have type 2 diabetes, and that one is both preventable and manageable. Diane Malberg is the Vice President of Pharmacy with HomeTown Pharmacy, and she joins us now to talk about diabetes and what she's doing to help people with their treatments. All right, let's start by talking about some of the signs to look out for. And this topic hits close to home for you, doesn't it?
It does. Actually, my dad, unfortunately, died of diabetes. So it's a horrible disease, but it can be managed.
Yeah, that's the good news. So for, the setting in of trouble, these signs and symptoms.
Sure.
Talk a bit about that.
Yeah, so some really common signs and symptoms that you see is this excessive thirst. Like you're just so thirsty you even get up in the middle of the night. Frequent urination, where you just feel like I couldn't possibly have drank that many fluids to have to go to the bathroom that often. Even a metal taste. You can get some fatigue. And some of these things they're common, so they may not ring any bells with a patient.
But at some point, some testing is done. What's the testing look like?
Sure. So there's a couple different things you can do. You can get a glucose test, very easy, by picking up a glucometer from a pharmacy, and you just prick your finger, little bit of blood, and you can get an instant read just in a couple of seconds. So that's one thing if you're ever concerned about that. Now, physicians will also look at a blood test called A1C. Now, normally you want that to be about 6.5 or under. If it gets over that, you may be starting to show some signs or symptoms of pre-diabetes, or the higher it gets is probably a good indicator of diabetes itself.
Yeah, okay, so pre-diabetes and full-blown. Tell me the difference. Is it just a difference of that number, like one side of it you're pre and the other side you're it?
Well, that's kind of a great indication. I mean, it's kind of like as you gain weight. I'm a little overweight and then I'm a lot overweight, and what you can do to prevent it in between. So if you're in a pre-diabetes stage, looking at what are supplements that you might be able to take, looking at diet and exercise, low-carb diets, increased fiber, all those things could prevent moving you from a pre-diabetic stage into a diabetic.
Got it. Treatment. It's, you used to think it was always just insulin shots. It's different now, isn't it?
It's very different. So there are a lot of medications that you can take nowadays. Things like metformin is a very common drug that we use in diabetic patients so that they don't have to take that insulin. And what it does is it helps your body use the insulin that they already have or stimulate production of more insulin. But there are some tricky things with even some of those medications because sometimes they can cause nutrient depletion.
So you walk alongside folks and supplement that experience.
Actually, yeah, we do. So one of the things that if you can talk to a pharmacist and talk to them about the medications that you have, they could evaluate the medicines that you're on. That metformin that I talked to, one of the things it does is it depletes B12. So I always recommend that the B12, anybody who's a diabetic patient, that's great because that helps do some regulating blood glucose. Cinnamon is one of those. Cinnamon, yeah, believe it or not. So it's great to put on different types of foods, but you can also get that over the counter. And again, it helps regulate the blood sugar so that it keeps it at a level that it should be.
Yeah, what's that third thing?
So I've got magnesium, which I'm going to tell you, this is one of my go-tos. Whether you have muscle fatigue, you're trying to regulate your blood sugar, you've got headaches, all those things, magnesium is always a great one to add to your regimen.
And as always, that consultation that you do with patients, that can happen on the regular at HomeTown Pharmacy.
You can ask any of our pharmacists, and again, we have a functional health medicine that will do a more rigorous evaluation with any patients, and you can visit our website and just schedule a consult.
All right, the website is HomeTown Pharmacy. Okay, I gotta get it right. HomeTownPharmacy.com/functional-health. And we'll put a link to that on our site at
Awesome.
nursingonyourside.com.
Thank you.
Thank you so much.